Guys, good afternoon. Hello. So today's live is all about mental health. So today is World Mental Health Day and उस occasion पे मैंने धरना को invite किया है and she's here. Hello. रोटी मैंने खा ली जी.
Hi Mohini, how are you?
I'm good. How are you?
I'm very well.
Long
It's
time.
Dharna, by the way. I heard my name and you said Dharna. It's Dharna.
It's Dharna. Okay. Sorry.
No
For
worries.
the wrong pronunciation. So, guys, Dharna is here, and today is World Mental Health Day, as I have already said this. And thank you for accepting this invite. Uh, and I would like to introduce you to my followers and the people who are here. So, can you just tell me about yourself?
Yeah. So, I'm Dharna and I'm a psychotherapist. I've been in the field for many years now, about 7 to 8 years of experience.
Wow.
I specialize in working with emotion management and disorders like anxiety, depression, um, things like that, or things that manifest through anxiety and depression, because often there are issues with binge eating or eating disorders in general, a lot of other neurodevelopmental conditions which also add to anxiety and depression. So I also work with that. But yes, primarily I work with anybody who's an adult, anybody who is above the age of 18 years, and I do work with senior citizens as well, and I work globally with everybody.
I'm sure this must be like really interesting as well as little tiring as well, right? It requires a lot of energy, drains you out, right?
Absolutely, absolutely. Working with people, and because there's so much of emotions that are traveling even in the session, like you tend to feel what your client is feeling, and there's so much energy exchange, so it can be a very draining profession. Young students who come to me to ask me like if they should take up psychology or not, I always tell them this, that it's a very draining profession. Go ahead, by all means, but remember that it can be very draining at times.
But this is something really good that, of course, it is draining, but you somehow also become happy. But that, yeah, you're solving, you're helping somebody in some or the other way.
Yeah,
Really
that's the
good.
biggest reward, isn't it?
Yes, totally. Okay, so guys, if you have any questions, you can also put it here. Okay, and meanwhile, I have few questions from Dharna, and I will be I will be discussing with her. But you can also like give your inputs if you want to ask anything from Dharna. Okay, so let's begin the session. Let me take out my notes.
Yes,
Okay.
very
So,
exciting.
like, first is why do you think nowadays more people are getting mental health issues than earlier time? Like, I think after COVID, we have seen like rise in mental health issues a lot. Like, if I talk about me as well, I was not very into parenthood or like different moods I had. That is majorly after the COVID has happened. So, what do you think is the major thing is going on?
Uh, I very strongly disagree here. It's
Mm-hmm.
not like after COVID people are having more mental health issues, not at all. The vulnerability, um, the mental health issues were always there.
Mm-hmm.
There was lack of awareness. That is why people were not really going to therapy. People were not really getting to understand that, oh, this worry that I have is actually anxiety, or
Mm-hmm.
this is actually making me dysfunctional in some way in my life. But during COVID, because everybody was on their phone so much, there was so much rise in awareness. And of course, uh, remembering that it was the time of a pandemic, so pandemic is not going to make you feel happy. It was a normal reaction to the situation as well, that everybody in general was worried. Everybody was worried for their loved ones, for their own health, for the community around us, for that matter. So that worry intensified any pre-existing conditions, like an added trigger. But it's not like that people were not going through mental health issues earlier. People were just neglecting it or just like pushing themselves to go ahead with it irrespective. That is I think even when we look at the 1900s and the 1800s and we read up about people having mental health issues, even when psychology was not a thing, really. Even then, a lot of women complained of having mental health issues, which was often labeled as hysteria. There was a lot of addiction going on, which was, again, a result of a mental health issue in the past. There was all kinds of psychotic issues going on. We hear from our families about, oh, this person experienced this delusion, hallucination, all of that. So there was all of that already going on. It's just labeled better now.
Yeah, I think more people are coming forward for therapy and they are acknowledging their emotions, which is somehow is a good thing. That earlier they were neglecting it, and yeah, of course, yeah, I can relate to whatever you are saying. Yes, yeah, earlier it used to happen, but we had like a lot of things to do, and we were not so close to so many things, and that fear which was inside us, right?
Absolutely. Even in childhood, like I think we all experience all kinds of different issues in our childhood itself. Like for 7, 8 years itself, we experience so much. And we just discredit it because it's not relevant anymore. But you have experienced it, so it's valid and relevant at all times.
So, Dharna, we have a question here. This is from Bochali Paharan. Hi, Dharna. I am a mother of 2 years old. After working for a year, I currently lost my job because of not being able to give much time to my work. Losing my job is making me feel very low and demotivated. Like, if you can suggest her something.
So, are just general question, maybe you can answer for yourself. Are you still looking for a job or not? Because both of those goals will have a different way, different procedure that we will follow. If in case you are looking for a job, then I suggest create a routine, follow a structure to your day. Make sure you have some job hunting time in your day, at some point, like 2 hours where you specifically dedicate to looking for work and doing something. Try to add more productive things in your day, and productive does not mean professional necessarily. It can be you doing some form of self-care, exercising, yoga, or anything else that you would like to include in your day. um, just having a certain structure to your day often helps a lot. Secondly, if there are a lot of negative feelings that are coming up, make sure you reflect back on the years that you have been working, 1 year or maybe possibly even before that, your academic years before that, and you try to look at the positives. There must be so many times where you thought that this will not go as you would like it to, or something is not right, but it still went on very well for you. So try to reflect on that, stay connected to that. It will give you the motivation to keep going and look for jobs. If in case you do not want to have like a professional career going on right now and you want to take a break and focus on your life, in that case try and indulge a lot more in socialization, your support system, your family, friends, all of that. Try to stay connected with them and indulge as much as you possibly can. Try to also again have a structure, like a morning evening structure at least, where you have certain things that you have to do. So it will just give you help you make more sense of your day. So that should be helpful. Try it out and let me know if it works.
Yeah, that's great advice. Anyone who wants to reach out, Dharna, you can always DM her. She's with me, and you can her hand as well. Okay. So let's move forward to the next question. Is society still denying the mental health conditions? Because I think I've heard from many people that कुछ नहीं होता mental health and it's all in your head. It doesn't happen. So do you think it's still happening a lot, or what we can do?
It
Like,
is. It is. It is. It is happening less than maybe 10-20 years ago from now, relatively. But looking at the society in general, it is still quite a lot. The numbers are not really gone down. We are still denying mental health conditions. We are still denying to give them the significance they deserve. Until anxiety or any kind of mental health condition becomes chronic enough to make a person dysfunctional, we do not think it is important. So it is really a huge taboo even now. Yes, people are opening up, but I think we still have like another at least 20-30 years to go until we as a society can really accept mental health issues and give them the importance that it needs. For now, it's very it's sort of very bad in terms of awareness also. Like urban areas, we still know, we still have heard about mental health conditions, but if you talk about rural areas, nobody even knows. And first question that people have when they come to therapy is it normal, or what will people think if I tell them I'm going to a therapist? That is still the primary concern. People don't even tell their families that they're seeking therapy, even when
Yeah.
they have chronic mental health issues. So if it was so normalized, why would people not be comfortable talking to their families about it?
Yeah. Totally there. And I think like if somebody's on prescription of XYZ reason, people start judging them. Oh, you're taking this, you must have some big issues and all, and they like will stop communicating to the person just because that person is going through something rather than helping. They will be like throwing stones on that person more. So I think as a society we are lacking a lot, that we need to work on this thing. लोगों की mental health के बारे में कि उनको कैसा feel हो रहा है is very important. That's well said. Okay, let's move forward to the next question. Okay, so there are like a lot of terms that people use nowadays. Okay, and I'm sure that a lot of people are not able to bifurcate between what is anxiety, what is panic attack, what is depression. So like in small things, people say, "Oh, I have depression," but like depression is quite a big term. As per my understanding, that can be anxiety. I think a
Yeah.
small and that like stays for like some time. So, like, how would you like to explain that? What is anxiety, panic attack, stress, or depression? What is the major difference in these terms?
So you said four terms: anxiety, panic attack, stress, and depression.
Yes.
I'll answer it in a slightly different manner. I'll take up stress first and then the other three. Okay.
Sure.
So stress is a relatively more umbrella term.
Mm-hmm.
So, any form of discomfort can often be characterized as stress. Now, when we talk about stress, there are also different categories of stress. Two main categories: eustress and distress. Eustress is the good stress that is needed in our body. Like when you do yoga, you put a little bit of stress on your muscle, you strain your muscle a little bit, but it's helpful for your body. It is actually going to do well for you. But if you push your ability too much, that creates a distress, and maybe a cramp, muscle spasm or something like that is going to happen if you stress yourself too much. That is the distress category. All disorders, be it anxiety, depression, psychosis, eating disorders, neurodevelopmental issues, if we are talking about a mental health disorder particularly, it has to have a characteristic of distress. If it's not distressing, you cannot characterize it as a disorder primarily. Okay. So this is stress. Any form of discomfort, any form of disruption in your routine can be characterized as distress. Now, when we talk about anxiety, um, anxiety is generally defined as a state of fear or excessive worry. When we're having too many thoughts, too much overthinking, we're constantly feeling restless, constantly worrying about one thing after another. That is often characterized as a state of anxiety. I am not saying that this means you have an anxiety disorder necessarily, because disorder characterizations are different than generic terms. I'm telling you about generically how can you classify anxiety. And anxiety is also an emotion, it's not only a disorder. Sometimes we are feeling anxious because we're feeling a certain emotion, and emotions are important for us to feel. It is not necessarily a bad thing for you to feel. Okay. Then Panic attack is classified as a disorder always. You cannot have a panic attack otherwise. So panic attack is an excessive phase of anxiety, when there is excess anxiety that you're feeling, which is also manifesting physically, like palpitations, breathlessness, pains and aches in body, zoning out, feeling like shaky hands, shaky legs, cold hands, cold feet, cold face, hot flashes. All of these can be physical manifestations of anxiety. And panic attacks usually have some physical element attached to it. It is, again, I am not saying that 100% of times it will have it, but like 90% of times majorly it will have a physical element going on. So that is how we characterize it, and they usually pass within 15 to 30 minutes approximately. Even if you don't do anything about it, they'll pass in 30 minutes maximum, hopefully. Now, depression is something quite different. Depression is again characterized as a disorder, usually, um, but it starts from a low state, sadness, feeling withdrawn from things, uh, changes in appetite, changes in sleep patterns, physical activity. All of these that can contribute to depression. Again, there is a certain criteria to diagnose depression. These are just some symptoms that I'm listing out. If you're having all of these symptoms also, that does not necessarily mean that you have a diagnosis of depression, because the intensity of it and how frequently they are happening would also help you identify if it is depression or if it is absolutely normal phase of life, and you don't have to do anything about it. Therefore, in mental health issues, even though a lot of times people just go online and just diagnose themselves, it is not advised, because you will have experienced all the things that any disorder has listed down as a diagnostic criteria. At some point or the other, you must have experienced all of that in your life, and we become biased when we are reading up like that. Therefore, you need a professional to diagnose you, and that's very important.
That is what is happening. Like people are self-diagnosing with themselves with different issues that they are just going to Google. Arey, I
Yeah.
have this. I must be going through this only. So,
I,
if you are
I get
listening, right?
so many people come up to me and say, I have bipolar and BPD and this and whatnot. And I'm like, okay, do you have a professional evaluation that somebody did for you? Said, no, I read up the symptoms and I know I have all of this. And then I'm like, okay, let's do an evaluation. Let's see if you really have it or not. Because most people will connect to symptoms. They must have felt low at some phase in their life. They must have felt withdrawn from doing daily chores, daily hygienic things, right? But that does not necessarily mean it's a disorder.
I don't touch that. Go to a professional for everything. That's what I always talk about in yoga as well. People just go to Google and do this and that into physical aspect as well, and they
Yeah.
end up doing nothing, injuring themselves. So this is
Yeah,
something you can also do mentally as well, that you're diagnosing and you're injuring your mentally.
absolutely. Imagine people doing the same for their physical health. How disruptive would that be? Same, people don't understand that how disruptive it can be in exercise, yoga, or when it comes to their mental health, and they just keep trying things out, and that can be very difficult, very impactful for the rest of their life.
Don't self-diagnose. Go consult a professional for everything you need. यार हम पढ़ रहे हैं किसी चीज को कोई तो रीजन होगा.
Absolutely, absolutely. There's a reason we have professionals. Yes.
Right. Okay. So next question is is depression is something that can pass into your generations? Like, can it be like followed by like a parent or something? You know, because someone I just met, like a friend who was telling me actually my father has depression, so I think I also have depression. Like, is this something like diabetes like that? It's not like that. It doesn't happen in that way.
So, if you read up old researchers, like I think most researchers until like 5 to 7 years ago from now, if you read up any of that, they will tell you that depression can pass on to generations and there is a heredity element to it. most researchers that you'll find online will state that. But in the last couple years, the new research that has come in shows that it creates a vulnerability to a small extent, yes. But that does not mean that you will have that problem. However, if you are in the same environment and you are predisposed to the same factors that triggered, let's say, your parent for depression or any other mental health issue for that matter, then the chance of you developing that mental health issue is much higher. So it is more environmental causes than genetic causes. A lot of studies show, like when kids are born, like twin studies, when kids are born, and if there is one baby that is kept with the biological family and one baby that is adopted by another family, the baby that was kept with biological family will develop the same issues as their parents, and it will be often labeled as genetics. But this baby that was given to an adopted family, because the environment is different, it's better, it's maybe in some way less helpful also for that matter, then the baby's growth and vulnerability will adapt based on that family. So if the family is healthier, the baby will have a much healthier lifestyle and no mental health issues, possibly, hopefully. But if the family's environment is worse than the biological family, then the baby will have many more issues relatively. So if environment is changing, the vulnerability is changing.
So we can say, like, if you want to grow a healthy, mentally healthy child, you need to work on your environment. You need to work on your parents. Like, that
Absolutely.
is more important.
Extremely important. I think this is the first thing that anybody who ever chooses to have a kid should keep in mind, that yes, we need a physically healthy baby, absolutely, but we also need a mentally healthy baby.
I think that's the most ignorant part, because when people talk about traumas, mostly are coming from their childhood only. Most of the time,
Trauma
we are facing,
are
they have faced something in childhood.
first 7 years, all your experiences in the first 7 years from the day of conception, you have formulated your personality. Anything after that is just a minor tweak.
That's quite interesting.
Yeah. And this is not just Western studies. Even when you read Chanakya's work, Chanakya Niti, and all of that, it is mentioned in there as well. That first 7 to 8 years of a child's life, their personality will be, identified. So even in our Vedas, a lot of this is mentioned. Even in Indian mythology.
So yeah, of course, like, give your child a good environment. We don't want more kids with traumas.
Yes. And who, in this day and age, who doesn't have trauma? Like, if we look back, everybody in their own life has some or the other form of trauma. So that says a lot about our society.
Yes, and I'm glad that people are acknowledging this, because, like, I teach prenatal. So whenever a student is coming to me, I ask them to work on their physical health, but as well as on their mental health as well, because that is going to impact the child who's coming in this world. And lately, he's going to, or she's going to, blame the parents only.
Yeah.
So let's not do that.
Yeah, a lot of people, like even doctors these days, are identifying Garbh Sanskar as a very important concept very recently. It's very recently come up. And what is Garbh Sanskar? Garbh Sanskar basically refers to, your pregnancy journey and you talking to the child during pregnancy and creating a healthier environment through pregnancy for the baby to grow. So that's something that has always been there, but we fail to follow that completely.
I hope someday we'll be making some changes. That's why we are trying to bring some change.
Absolutely.
Okay. So my next question is, who should be the first person to reach out if you feel something wrong mentally? Like, some days I feel that if somebody is going through mental issues, they are not very comfortable with the person they know already, because they might have this fear that, oh, if I tell this person I'm going through this and I have gone through this, something has happened, that person might judge me. So because of that, I think so many people are keeping it inside their own. So there should be a way. Like, what do you think? Who should be the first person to reach out if somebody is facing like that?
Um, it can be a friend or a partner or a family member if you feel comfortable enough to open up to them. However, I have seen in a lot of situations people just don't want to open up to somebody in their immediate support system. They need time to process and be comfortable enough to open up to them. So that's when I usually suggest immediately go to a therapist. It's not gonna hurt you. It's not gonna create any problems in your life. The appointments are completely confidential, completely private. So speak to a therapist. They will also help you open up to your support system, not just work with you with respect to the problem. And if you already know that there is something wrong going on mentally, something is not right, then you anyway know that you have to take treatment, right? You have to go to a therapist. Even if you choose to go to a psychiatrist alone cannot do all the work. It has to be clubbed with therapy if you need a long term solution to your problem. If you want a temporary patch to your problem, then a psychiatrist is more than enough to go ahead with. But yes, I usually suggest go to a therapist, speak to them. They will help you identify if there is something that needs help, how create an intervention plan, whatever is going on, help you out with that. And that usually eases things out. If you do have a family member or a friend that you're comfortable enough with, then
Of course, we should reach out. Like, of course, everything is like different, comfortable in a different environment with a different person. So yeah, the main goal is to reach out whosoever you want to.
yes, absolutely.
My next question is, okay, so the very common topic that I like see a lot is the postpartum depression. I've seen cases where postpartum depression can be life, and what all should family and mother should do to avoid such cases. Right, I think in India, as per my teachings, I've observed that they expect women to get back to their things normal, but like the major change that has happened in her body, they don't allow her to process. I think that is the major reason that the postpartum depression things are increasing. So, like, what do you think? Like, how a family or the person who has conceived or has given birth should handle the situation?
So, a couple of things, and I'll divide it between mother and the family what they can do. So, when it comes to the mother, she needs to make sure that she's physically and emotionally ready to have the baby, before even trying to get there. Because if she's already feeling vulnerable emotionally, physical fitness is not in place, some other problems are going on, too much stress at work, anything like that is happening, then we already know that the mother will only be predisposed to other mental health conditions during and after the pregnancy. It is not going to be helpful. So this criteria, I always suggest make sure that you take your time, you prepare yourself, you get your prenatal vitamins that you have to start before even trying, and then start with trying to have a baby and all of that. Once the mother has conceived, it is very important for you to take time for yourself and work on your physical and mental health both. Physical fitness for a birth is very important, but so is your mental fitness. If you are not processing your emotions, if you are not expressing yourself, if you do not have a support system, let's say in form of a partner or family or friends to talk to about whatever things are coming to your mind, even though a lot of it could just be hormonal because there's just too much happening with your body at the time, you will not feel comfortable. We also have to remember two very important things that happen with a woman during pregnancy. One, the body completely changes, like from their physical appearance to how they're feeling, how they have always carried themselves, the clothes they love to wear, they can't fit into them anymore. So the entire concept of comfort changes for them. They can't really independently do so much physical activity as well. That also shifts. They're not as independent as they would have been before the pregnancy. So the family has to come in, and family often steps in around this time. Family steps in, family rarely takes care of the mother, does their best, but as soon as the mother is given birth, all that attention goes to the baby and the mother is left alone. And that creates such a big shift in energy for the mother, because she had everyone until she had given birth, and now she has no one immediately. Nobody to talk to, and everybody at the same time is also telling her what's the right thing for her to do with the baby. We do not need that. We can let the mother breathe in peace for some days. She is a mother. She will learn on the job. Nobody is born as a perfect mother. So mothers will learn on the job. They will not hurt or harm their baby. But you have to give the mother a little bit of time to develop that relationship with the baby, to be able to understand their baby's needs. And every baby's needs is different. It cannot be the same. Um, Secondly, when the is mother's body is changing physically, um, the baby is also growing at the same time. There is just too much happening hormonally also in the body. Um, a lot of doctors these days encourage C-sections a lot, right? Instead of vaginal birth,
That's like a
which
lot of
is,
whole topic together, but
yes,
whole thing is
absolutely. But C-sections can be very damaging for the baby's mental health. I'm not even talking about the physical health and the physical repercussions of it. Labor starts when the baby is ready to come out. Baby starts kicking, and then you start having um, cramps, and the labor begins, right? But the baby has to tell you that it's ready to come out. If doctor is choosing when the baby is ready to come out, that is not right.
actually this happens with one of my friends. She was forced to give the C-section thing because they had lined up all the women for the delivery, and it was such a painful experience she had. And I don't understand why, like just because of money, they are pushing women's body to such extent where she's
Yeah.
almost like feeling like nothing, and everything is impacting her body, her child, her mental health, physical health, everything.
Yes. And Moini, imagine a little tiny baby who barely has any connection with the world comes into a room full of unknown people screaming mother, even when it was not ready to come out. How is that not an emotional trauma for the baby? And this creates a lot of, because in India now I think it's changing, but for the most part we did not let the mother cuddle or have a kangaroo touch with the baby as well, right after birth, right? So that further, the baby was just born who only knows who his mother is, his her mother is at the time, is taken away from the mother for 2 days, 3 days, 5 days, whatever time you have to put the baby in the NICU for. But it's just completely taken away and has no contact with the mother, is feeling alone and lonely, and is probably thinking, why has my mother abandoned me immediately?
Yes.
So that we talk about abandonment issues, we are birthing kids with abandonment issues. How will kids feel loved?
That's where the
If
trauma begins.
that's where the trauma begins. That's the most commonly, this is the first trauma of most people's lives. So, and we are not, physical aspects of a C-section, we're still starting to give some importance to physical repercussions of it, but mental, nobody even talks about it. And this is the first trauma.
For most of the people, it doesn't even exist. बच्चा है क्या वैसे क्या होगा? Like they don't understand how it
बच्चे
grows inside.
को समझ थोड़ी है, बच्चे को
हाँ.
सब समझ में आ रहा है.
Like if you like throw a baby like three parts, if you see there are a lot of videos, they are responding to the swimming, they are responding, if they're falling, they are holding the things, they know things, and cannot deny that they are not feeling it. They don't have this mental thing there. It is there,
Yeah.
already there. It started developing in the womb.
Yeah, and some studies also say colic, which almost every baby goes through, having a colic phase in their younger life. Again, psychogenic in nature. It is not a physical thing that's happening. It is a psychological condition that a kid goes through, where the kid is not feeling good, is feeling vulnerable, first experience to negative emotions, does not know how to handle it. But again, something that more people should be aware of. But yeah, just to complete, the mother has to be ready. The mother has to pay enough attention to herself, even if nobody else is. And the family really needs to prioritize the mother and not just the baby after birth. The mother needs to be given just as much importance as she was given during the course of the pregnancy. And one thing that I realized with one of my recent clients who was postpartum, was the family completely denied the mother of having any kind of things that worked for the mother. The food that the mother liked just changed into absolutely bland food. Going out was eliminated. Using the phone was stopped. So the mother cannot really do anything that she enjoys.
That will definitely
So where
lead to something mental health issues, of course.
yes, it will lead to a lot of deterioration. You have to, yes, I agree, there has to be some changes with respect to the baby, but bits and portions of positive factors are also important. You
He also
cannot completely
feels
deny.
that you are not important. That kid is important. You're not important. That such
Yeah, yeah,
self-creating
and you have to sacrifice your entire life and happiness only for the kid. No, being a mother should be the most beautiful phase of anyone's life, and if it is giving you so much disruption in your mental health, not worth it. Then you know that something is not right, and you have to take charge in your hands, and you have to fix that and make it into the most beautiful phase of your life.
it was quite interesting. Thanks for the explanation. Next is okay, like of course I teach this to people, but and in your perspective, how being physically active or meditation helps in dealing with mental health conditions? Because what happens, like there are a lot of students of mine, they are going through something, they will quit everything, they will stop moving, they will not attend the classes, and I think this is something very important because me, I have also taken session from you as well, and in a lot of things which goes around me, I think yoga, my gymming, my meditation, me being physically active helps me a lot. It does help me a lot, but I don't know how to express this, explain this to a person who's going through so many things.
I think one thing that I am quite an advocate of is, अगर हमारे बड़े कुछ कह रहे हैं, maybe there is some truth to it. कभी भी कुछ भी प्रॉब्लम्स होती हैं लाइफ में, स्किन, हेयर, फिजिकल हेल्थ, मेंटल हेल्थ, आवर दादीज एंड नानीज आर ऑलवेज लाइक, बेटा पानी पी लो और सो जाओ, ठीक हो जाएगा, right? I am not saying that is the only solution, but there is some truth to it, because sleep will reset your mind. It will help you recover faster, whatever the problem is. Water, when we are talking about any mental health issues, anxiety, stress, depression, कुछ भी, ठीक है? We are talking about a lot of hormonal disruption in our body. Water is going to flush it all out. The lack of water, if you're dehydrated, no flushing out is happening. The cortisol is going to stay within your body, and no space for happy hormones to be processed by your brain, because cortisol ही इतना ज़्यादा हो गया body में, तो कैसे flush out होगा? ठीक है. Physical activity or meditation are one of those things that our nannies and daddies are quite an advocate of, कि कसरत कर लो, ये कर लो, वो कर लो, etc. Physical activity, there is a bare minimum amount of physical activity that is required by each individual on a day-to-day basis for their mental and physical health to be at a stable capacity. Again, physical activity हम करेंगे तभी जो हॉर्मोन्स, जो एक्स्ट्रा चीज़ें हमारी बॉडी में एक्यूमुलेट हो रही हैं, वो मूव करेंगी, एंड दे विल start getting flushed out. Physical activity also increases serotonin and oxytocin का production in our brain because it makes us feel good, makes us feel energetic. Adrenaline बढ़ता है. जिम वाले जो भी लोग होते हैं उनसे पूछो जिम जाना अच्छा लगता है, it will be their favorite thing to do because बहुत सारा adrenaline rush होता है, which is a positive hormone, right? It makes you feel good, motivated, gives you an energy boost. Therefore, physical activity plays a very significant role for your mental and physical health. I usually suggest physical activity can be of any kind. जो भी पसंद है वो कर लो. Run, walk, yoga, gym. Yoga के, however, benefits are relatively more in comparison to anything else that I have observed. Even dancing works. So people who love to dance, go ahead, dance away your worries. That works. Okay. Meditation, there is a restriction when it comes to meditation. Meditation is very helpful for most people who have a lot of excessive worry, overthinking, stuff like that going on. Okay. But meditation usually improves focus and brings you to a lower, calmer state. So जब हम hyper state वाले issues face कर रहे होते हैं, that is excessive worry, anxiety, restlessness, hypertension, something like that, that will be helpful to bring to get to a lower state and relax yourself. But if you're experiencing sadness or depression like symptoms, then meditation is not recommended because it will put your state even further. Then I recommend do some physical activity for 5-10 minutes and after that do meditation, because then your body will get into a hyper zone and then you can calm it down in a better way. So that could work. But meditation again helps you focus on the right things. It helps you focus on your breath, on your third eye, depending on what kind of meditation you are into. But it improves focus and it calms down your system. And that is how it is helpful. Okay.
So really, really important to at least move physically. So this is how we structure our classes as well. Normally, this is how we do asana, pranayam, and the meditation part, dhyana part. So this is how these classes are also structured in yoga.
Yeah.
We talk about 1 hour, 40-45 minutes will be the yoga session will be there, and then breathing practice, and then there will be shavasana. So this is how like everybody's working and everybody's encouraging people to like at least focus on themselves. It's such bad thing that everybody is like focusing on their career, XYZ thing, but for when it comes to self-love, when it comes to taking care of our own physical and mental health, no, they are just that will take a
And
back seat.
that is why we need to do yoga or any physical activity also with a professional. At least have a good idea to begin with a professional, and then once you have a hang of it, maybe.
I'm just talking about the physical aspect. When they don't do it, they're just going to YouTube, and I've heard people getting injury out of that. That will make it more worse. Don't do
Yeah.
that.
Yeah, absolutely. And if you think you can't go to a professional due to any reasons, then stick to dancing or walk or run, which are simpler things for you to do instead of doing anything that can lead to an injury at any point.
That's fine. Okay. So my next question is: in our society, men still feel they do not need to share their thoughts with someone. What do you think we should do to let them know, get out of their shell?
Give them space.
Sorry, your voice got.
Just give them space. Keep talking to them about your feelings, how you feel, how maybe opening up helps you, encourage them to, but also give them space. A lot of times, when we are after somebody for them to open up, they feel even more reserved to open up and they will not open up like that. However, if you just give men some space, let them know that I'm here if you need me. If you don't want to talk, that's okay too. That in itself, in a few days, will make them comfortable enough to talk about whatever's going on. So I think it is very important, I think, to give them the space, because women can work usually very well when they're given more attention and they're being asked that, hey, tell me what's happening, tell me what's happening, tell me what's happening. That's how most women operate. But for men, that does not necessarily work. So just
We are wired
them the space. Yeah. Usually that, and of course keep improving the awareness, keep talking about how important are mental health issues, keep showing that you are there for uh, y- your man, your father, brother, friend, partner, whoever that is. Keep showing up, and I'm sure they'll open up soon.
Does this happen with my father, and we were not able to uh, find out that he's in depression. He was going through some mental issues until it became very extreme. When we were like giving him space and things, but it was such a bad state that we could not even handle it. So I think we should talk more about mental health as well, because like as a woman we are all getting attention like during pregnancy, after, like of course we need to work on that as well, but somehow we're getting the attention, but we cannot like ignore entire gender. So we need to take care of them
Yeah.
as well.
No, definitely we need to take care of them. Giving them space, but also making sure that you are there for them, and they know that you're there for them. You are their support system. Both of them are equally important, because if they do not recognize you as somebody who is safe for them to open up with, it will not work for them. They will not open up. You will not open up if you think somebody is not really going to understand your feelings and thoughts and emotions. So they are not going to do that either.
That's fine. So my next question is, nowadays OCD and ADHD term has been used widely. If someone lacks attention, people start giving them ADHD ka title. Or if somebody is particular like cleanliness and like I have OCD, I like everything clean. So what is the correct way of diagnose these issues rather than assumption, rather than using Google? People are doing.
Yeah, and this is very common, and I've seen this with even my friends, and I hate it. But yes, OCD and ADHD both are really um, important mental health conditions, and they are often generalized. Like you said, कोई सफाई कर रहा होता है हम बोल देते हैं OCD है, but ऐसा नहीं है, बिल्कुल भी नहीं है. OCD में भी certain criteria होना चाहिए. हमारी mothers रोज सफाई करती हैं घर की. They'll do the dusting, they'll figure out the kitchen, organize things, all of that. हम अपनी mothers को तो नहीं बोलते आपको OCD है.
That.
रोज करती है वो तो, और पता नहीं कितने सालों से कर रही हैं. Because OCD is obsessiveness and compulsion. It can happen independently also. Self obsessiveness या self compulsions भी हो सकती हैं. बट यूजुअली रेपिटेटिव बिहेवियर होना चाहिए. क्लीन जगह को भी जब कोई साफ कर रहा है, और क्लेanलीनेस सिर्फ एक कंपोनेंट होता है ओसीडी का. जरूरी नहीं है कि किसी को ओसीडी हो तो वो क्लीन करेगा ही करेगा, ऐसा बिल्कुल भी नहीं है. बहुत बार लोगों को ओसीडी होता है और क्लेanलीनेस बिल्कुल भी नहीं होती. They're not cleaning anything at all, not even thinking about cleaning. Rather, the obsessions could be sometimes sexual, it could be about counting, it could be about some form of paranoia कि कोई घर में आ जाएगा तो घर लॉक करके रखना है. It could be multiple different categories. ऐसा नहीं है कि सिर्फ cleanliness को लेके होगा, बिल्कुल भी नहीं है. OCD, ADHD दोनों के लिए we have structured tests that we do for evaluation. There is also clinical interview. उसमें individual को खुद symptomology का description देना होता है. The therapist or the clinician will ask a couple of questions. उसके बेसिस पे क्लिनिकली भी हम evaluate कर सकते हैं या फिर टेस्टिंग के थ्रू हम evaluate कर सकते हैं. बोथ आर वेरी रिलायबल मेजर्स. किसी में कोई रिस्क नहीं है इवैल्यूएशन का. अगर आपको लगता है कि आपको क्लेanलीनेस बहुत ज़्यादा अच्छा लगता है, या आपको इनअटेंशन या हाइपर एक्टिविटी से ज़्यादा लाइफ में डिस्ट्रप्शन हो रहा है, यू कैन ऑलवेज कम इन फॉर एन इवैल्यूएशन. Get yourself evaluated. Based on that, we will also start an intervention plan which fits the best for you. Most of the times,
Well,
both these conditions can be taken care of without medication.
so next time you're hearing somebody ADHD OCD, please ask them to go for the tests.
Yes.
Just don't assume, just go on Google or somebody said this to you. I think there was a viral video of Ranbir Kapoor as well, and people pointing him out as well. He said that I have OCD. like people don't know if he has done the test or not, if, or might be just saying it out of the context of cleanliness. So yeah, you need to get yourself tested.
Movies and shows in general have made it quite normalized for us to use these terms now. Uh, to say, I think one very immediate reference I can remember is Monica from Friends, who likes cleaning a lot,
Yes.
but may not have OCD. So that some people just like cleanliness. That does not make it OCD. If you like drawing, does not necessarily mean that are you have to be an artist.
Exactly.
So it needs a lot of other additional work, evaluation, diagnosis with clinical interview, etc., and only then one can diagnose.
Making sense. So, um, I have this question. If someone has suicidal thoughts, or what should they do? Like, what do you think? There are helplines available, and what are the ways? Of course, like if someone has such thoughts or having such thoughts, it has gone through a lot, I'm sure. But what could be the prevention? Because there are so many cases that we hear that the person was like happy going, posting stories, and the next moment we hear a bad news. So, what are the ways to prevent such actions? You think?
Um, Keep checking in on one another, on your friends, family, everyone around you, especially if you know that this person is struggling in any way with their mental health. Make sure you're checking in on them regularly, letting them know that you're there for them. They can reach out to you whenever the need be. And for people who are experiencing any of these thoughts, one, professional help, extremely important. Go, please get professional help that you need immediately. Secondly, whenever you're having suicidal ideation, first step, go sit with a loved one or talk to a loved one immediately. Do not let yourself be alone at all. Secondly, I usually suggest that if you're having any of these intrusive thoughts or suicidal ideation, imagine how, Donald Duck would say these things in your head. Imagine the same thoughts in your mind. Like it brought a smile to your face, anybody would start to smile and feel like a tad bit lighter immediately as they think about it. So choose your favorite cartoon characters, possibly funny ones, and try to mimic the same thoughts in your head in their voice. That usually immediately, disrupts the impact of these thoughts. Having a loved one around is again going to be helpful. Third is reaching out to a professional for help, uh, for whatever might be troubling you. And yeah, pretty much this should be helpful. Now, the other things that I can recommend would depend a lot on the subjectivity of the situation. So, depending on who is going through what kind of thoughts, we can talk more about what are the ways of um, stopping this. A lot of people have these thoughts and they just want to feel a tiny bit of pain. So for them, I usually recommend have like a hair tie on your hand and just stretch it and give yourself a little tiny sense of pain, which is not going to hurt you or harm you in any way, but it will give you a slight sense of pain, which will calm you down immediately. So that is it.
Uh, So these were the questions from me, and I think we are at the end of the session. If somebody wants to ask anything, you can ask here. And yeah, this was very informative and very wonderful session. Thank you, Dharna, for accepting the invite. And
Thank you for having me. It was great, and I hope that people got to learn
I'm
something.
sure, because I think we have gone to like almost we have touched all the topics, which can help one or the other person in some way at least. And so this was the day and great session. I'll be like uploading this on my page. And I'll send you the invite as well. so the people who might have not joined can see it later. Okay. Right. Thank you so much. Okay,
Thank
thank
you
you.
for having me, Moini. Hope to do this again
Yeah,
sometime.
of course. It was fun. Thank you.
All
Take care.
right.
Bye.
Happy Mental Health Day, everybody.
Yeah. Happy Mental Health Day. Bye.